So one of the breakthroughs our group made a few years ago, in fact, this was work that I believe initially was presented at ASCO, but then subsequently was presented at SITC as well, was the fact that apart from looking at just the radiomic patterns of the tumor or the immediately tumor adjacent regions, that there was great value that was embedded in the vasculature associated with the tumor. And in particular, it wasn't just the amount or the density of the vasculature. It actually related to the twistedness and the convolutedness of the vasculature associated with the tumor. And what we found that was so exciting was that the greater the twistedness of the vasculature, the more likely it was that the patient was not going to respond to therapy. And our initial work looked at chemotherapy, and specifically in the context of breast cancer, in the context of neoadjuvant anthracycline therapy. We published related work in the Journal of Clinical Cancer Research over the summer, demonstrating that the more twisted vasculature on a breast MRI exam for breast cancer patients, the more likely it was that these patients were not going to respond to neoadjuvant anthracycline therapy. But the smoother the vasculature, the more likely it was that these patients were going to achieve pathologic complete response and were going to favorably respond to neoadjuvant anthracycline therapy. What we've also done now is to demonstrate that twistedness of the tumor-associated vasculature is also implicated in response to other kinds of treatments like immunotherapy and in the context of other disease indications like lung cancer, for instance. And so we're really excited about this work because we think that we potentially have here an additional novel biomarker that can do a couple of things. One, predict response in a multi-cancer way. So we've seen now, at least for breast and lung, that these features can potentially add value. But secondly, and critically, it seems to be a marker that is associated with response across different therapies. And the fact that it works both in the context of chemotherapy, that is neoadjuvant anthracycline, but also checkpoint blockade and immunotherapy, which of course is a completely different family of treatments, is really exciting because it means that this has implications over and above a single indication or a single class of drugs.